My name is David Wood. I'm the LEAP Programme Manager. I would like to introduce you to our presenters for the webinar, Carla Stanke, LEAP's Public Health Specialist, and Claire Dunn, LEAP's Evaluation and Research Manager. So over to Claire and Carla.
Thank you. So yeah, as David said, Carla and myself are going to be talking you through the findings of our COVID research that we led pretty much from March last year, almost a year ago. So I'm just going to talk about the rationale and the background to the research. So if I can have the next slide, David. Great. So last March 23rd was when the UK went into the first national lockdown, and we realised very quickly that the impact that COVID was going to have on our families and practitioners and services was going to be significant, and that these impacts were being felt pretty much immediately. And we realised as a team that we wanted to understand what that impact was going to be in the short, medium and longer term as well. So in order to do that, we assembled a research team in-house, which comprised the public health team and members of the evaluation and research team as well. So you can have the next slide, David. Great. So our research plan that we developed, we decided that in order to, as the crisis was emerging, we realised that the impacts were going to evolve as we were learning what the pandemic was and what COVID-19 was and how it was going to impact the community. So we realised that initially we wanted to gather some opportunistic insights from our services and practitioners. So this was going to be our first phase of the research. So this happened in March and April 2020. And alongside those opportunistic insights, we also led some secondary research where we gathered information from the national and international findings that were emerging at the time. Then moving on from that, we between May and November 2020, we led phase 2 of the research, which was aiming to capture the intermediate impacts of COVID-19 on the families and practitioners that LEAPS works with. And then moving on from this, as we're realising and the situation is evolving, obviously, and we're learning about the impact that COVID is having and will continue to have, we are planning a phase 3 of the research, which will look to capture the longer term impacts of COVID-19. So can I have the next slide, David? Thank you. So thinking about when we developed the rationale of the research, we realised that we needed to focus on the impact on need of the families that we work with. So how were the local population experiencing either increased harms or stresses as a result of the COVID-19 crisis and the resulting lockdown? Were the local population experiencing new or increased benefits as a result of the COVID-19 crisis and resulting lockdown? And to what extent are children, families and practitioners aware of these changing needs in the short, medium and long term? In terms of reach, we wanted to understand, in light of the COVID-19 pandemic, how service users' patterns of engagement with LEAP and other early help support had changed. And we wanted to understand the impact of adapting to remote and digital delivery of early intervention services, and whether there were specific groups or subgroups of beneficiaries who are more or less likely to engage with this offer. And if so, did we understand the reasons behind this, and were there things that we needed to address to combat things like digital exclusion? In terms of provision, we wanted to understand how services and the core team were adapting to the context of COVID-19 and to what extent these adaptations had been effective, and whether there were good practice examples that we could continue to build on moving forward through the COVID-19 pandemic and beyond. And we also wanted to consider whether any of the local authority budgets were being impacted by the crisis, and whether this was going to affect the scale of provision that was happening locally. And then finally, we needed to consider the extent to which LEAP's goals or outcomes were being affected, and whether they're going to be more challenging to meet in light of the pandemic, and if so, how should we respond to this? So we developed a research plan that was sort of threefold, so working with practitioners and families and the core team to try and answer these questions in a robust way. Can I have the next slide, David? Great. So, sorry, I was just going to hand over to Carla for this slide.
Thanks, Claire. So the first phase of the research was just as Claire described, and this was what we're calling the opportunistic insights phase. And this we did almost immediately when we went into lockdown. So this was very unsystematic and quick, very rapid. So what we did is we, as a core team, we approached primarily the LEAP workforce, and we asked them, what kinds of things are you observing? What are you observing in families? How have your working patterns changed? These kinds of questions. And it was just as and when people could reply. We had responses from quite a few practitioners. There were at least 12 services represented, and some members of the LEAP core team responded too. So again, it was very quick and very unstructured, just as and when people could feed back to us what was happening on the ground. Next slide, please, David. And this is just a summary. The analysis we did on this was very, very quick. We looked at what people sent back to us, and we clustered it according to topic. So the main themes, this will be probably now 1 year into this pandemic, quite unsurprising for you. But the themes that came up were child health and well-being, family relationships, finance and unemployment, food insecurity and nutrition, housing, inequalities, parental health and well-being, and home learning and home education. I don't think it's probably worth fleshing out the sub-themes in this. We did write these up. There is a report, Claire, I think that's right. These are included in, I think, one of the A Better Start reports. So all of this from all 5 A Better Start sites, these are included in that report. Next slide, please, David.
Great. So as Carla said, so we sort of gathered these opportunistic insights from practitioners across the core team, and these were gathered together, and we grouped them into those themes, as Carla said. And then sort of what was happening in parallel to that was the evaluation research team were gathering insights from the national and international evidence that was emerging very rapidly, so sort of from March really and April. And a lot of the research and reports that were being published were looking at the impact of the pandemic on early childhood development. So having considered the themes that were identified by our practitioners, we use that structure to guide the gathering of the evidence and collation of the evidence that was being published nationally and internationally. And from that, 6 key themes were identified from the research that was gathered, and a research briefing was published in April 2020, which can be found on our website. Can I have the next slide, David, please? So the 6 key themes that emerged that we considered to be relevant for LEAP, considering the short and medium term impacts on the programme, were so the social implications, considering the impact of COVID-19 was not being felt equally across society. the impact on physical health, so child diet and nutrition and child access to outdoor and green space, mental health and well-being, which included both parental and child mental health, education, and specifically the inequalities that were emerging through the lockdown and being at home, and the impacts on the home learning environment for our cohort specifically. And then financial implications, so the impacts on household income and unemployment and child poverty. And finally, vulnerable children and families, so families who are experiencing inadequate housing or domestic abuse, single parent families, and looked after and SEND children. Can I have the next slide, David, please?
So this brought us then to the second phase of the research portfolio, which was some primary work with our families and practitioners. And this was again to understand the impacts of the pandemic on families' needs and how they were, as Claire already described, engaging with services, albeit in a different way. We chose to do this with a mixed methods approach. We did some qualitative work, some interviews, and we did quantitative work as well in the form of surveys. This was broken down into 3 work streams. The first thing that we did was a survey with families in Lambeth. We did this in August, and I think it's important to note the time when we did these activities, because as everybody on this call is aware, over the last year, we've been in and out of periods of restrictions, in and out of lockdowns, including in some periods where it just felt very vague and we weren't really quite sure which phase we were in. So I've tried to delineate where we were in terms of lockdown and restrictions. So the first thing we did was a survey with families that was in August of last year, and that was sort of in a period of eased restrictions. The second activity we did was a survey with our providers, the LEAP workforce. This was in September at a time when the rates were starting to rise again, and tighter restrictions were being introduced around the country, but not quite yet in London. The third thing we did was a series of family interviews. This was in October, November. We were in tier 2 at that point in London, but the country itself was on the brink of our second lockdown. We did have a review by NCB's Research and Ethics Advisory Group. So they looked at our plan, they looked at our questions, and we got feedback on that. Next slide, please, David. So the findings of the survey, we did 2 different ways. We did these electronically and we did these by post. We had 84 responses in total. 79 of them were included in analysis. The ones that weren't were either, the only specification to participate in this was that you had to be age 16 or older, you had to live in Lambeth, and you had to have a child under the age of 5. So the surveys that were not included in the analysis didn't tick those boxes. We did offer a prize draw for people to participate. We offered 20 vouchers at £10 each. In terms of the demographics of the people who responded, only 6 people reported they don't speak English at home. Most respondents lived in rented accommodation, primarily in flats. Most respondents had some kind of access to outdoor space, but interestingly, 22% of people who responded did not have any. Most respondents had some type of access at home to being online, whether from their phones or from Wi-Fi. And finally, the ethnic breakdown of participants: 46% white, 28% Black, 7.5% Asian, 7.5% other, and 11% preferred not to say. Next slide, please, David. And when you look at the results of this, I haven't, for the purposes of the webinar today, I haven't provided a lot of detail. I thought because there's so many, we've done so many things, and I think because we only have 1 hour, I thought it was best to just focus on the highlights, the key themes that we learned. So the first thing that we learned from doing this was that some good stuff happened for adults, including spending more time with family and spending less money. There were good things that also occurred for children, again, spending more time with their family, and they felt there was more connection. The adults who participated said that they felt that their kids were more connected with family. A lot of worries and stresses were talked about and indicated as well, including the most popular ones that people said were about worries about their children's future, worrying about their own mental health and well-being, worrying about COVID, either catching it themselves or their families, and work and finance problems, of course. In terms of people's preferred ways to receive support, people did prefer face-to-face, of course, and phone calls. Again, remember the timing of this. This was done back in August, so I feel like at that point we might not have been as proficient with Zoom and Teams and all these other platforms like we are now. And the most common kinds of support that people received were either support from children's centers or with food parcels. Next slide, please, David. And I've included some quotes. We got some good quotes from people. I'm not going to read these word for word, but one parent said, unfortunately, playing was 99% screen time. Another parent said, we did spend more time outside because the weather was good, which we all remember, it was sunny. We're fortunate enough to have a garden, but we would have spent less time outside if we didn't have a garden. My kids feel that they have no friends anymore. I have a 2-year-old girl and she feels strange when we see people that they used to see before. And finally, my son was born during lockdown. He lost a lot of weight due to an undiagnosed tongue tie, which was not detected due to lack of home visits after he was born. It's quite interesting. Next slide, please, David.
Great. So the next sort of work stream within phase 2 of the research was to engage our practitioners who obviously were working on the front line and had first-hand experience of the impact that the pandemic was having for families. So we invited 74 practitioners in total to complete a survey online using SurveyMonkey. We got 39 responses, so a 53% response rate. And we had all strands from LEAP represented in these responses. So one of the questions we were interested in was whether any practitioners had been redeployed since the period of March 23rd, 2020. And so, as Carla said, this survey was distributed in September. So we were talking about quite a long time period. And by redeployed, we were meaning whether they were at any point in their work week, I suppose. It wasn't if they were redeployed 100% of their time, but whether they were redeployed at all was the nature of the question. So we had 33% of those who responded, so 13 people had been redeployed, and of those who were redeployed, 38.5% or 5 people were from both the diet and nutrition and social and emotional development strands, and 1 was from the communication and language development strand. Next slide, please, David. So one of the questions we were interested in, as I sort of outlined at the beginning in terms of the research questions, were need and provision and engagement. And so this question was sort of phrased around the anecdotal things that we'd heard in the opportunistic insights, which was that we understood that some families were facing barriers to engaging with services during lockdown. And so we asked practitioners, based on their experience in their roles, to what extent do you agree with the following statements, which is whether families had not been accessing LEAP or other early help services because of the following barriers. And the most common barrier that practitioners, so these are who agreed or strongly agreed that this was a barrier, was digital exclusion. And then following that, cultural or language barriers, and then lack of headspace or capacity for parents, that is, lack of childcare, lack of awareness of services, then support that was no longer needed or wanted, support that is needed or wanted was no longer available for families. Families not being able to access support that involved leaving home, lack of time, concerns about privacy online, and a lack of trust or confidence in services. So there was definitely a perception for practitioners that these barriers were stopping families engaging with services. Can I have the next slide, David, please? Thank you. So this question for practitioners was asking, considering the ways that COVID has changed services, content or provision or staffing, to what extent have these changes been positive or negative? And again, like Carla said, we have so much data at this stage which is being written up. So I've just pulled out a couple of the most frequent reported impacts. So the practitioners who responded positive and extremely positive changes were the increased role of digital technology. So this is the number is 24 practitioners reported this as a positive or extremely positive change for their service, followed by team members having necessary skills for the work, so feeling like they were skilled enough to use digital offers and different technologies to provide for families virtually. They thought that the service being accessible for families was a positive change. Family satisfaction with service was positive, and how inclusive the services were for families was a positive. In terms of negative impacts and changes, services reported that managing data collection and analysis was more difficult during this time, and recruitment of families and referral to services was more difficult. And then efficiency of delivery, team well-being, and again how accessible the service was for families, some practitioners found difficult. Can I have the next slide, David? So we asked practitioners that from the period of March 23rd, compared to the period before the pandemic, were there any groups who were more or less engaged with your service than they were before? And I've just pulled out here the groups that were identified as being less engaged. So practitioners identified the following groups as having decreased engagement, and this was an open text response, so this has been analysed thematically. And so the groups identified as less engaged were families who are experiencing technology challenges. An example of what a practitioner reported was saying that families with poor access to digital resources have been the hardest to maintain engagement with, and 9 practitioners reported digital or technology challenges as a barrier to engagement. Antenatal care, so there was again, it's important to say that this is obviously a snapshot in time, and this has now changed, as you can see in this quote from a practitioner. But one practitioner said that they've supported far fewer women antenatally, although they were starting to see more referrals for that group now that baby steps had resumed, and 3 practitioners reported that group as well. In terms of families who speak English as a second language, that was reported as a barrier to engagement. The challenge of recruiting new families was reported, families who have no recourse to public funds, and finally families who were experiencing mental health challenges as well saw less engagement. Can I have the next slide, David?
So the next bit of research that we did, the next phase, were some interviews with families. We did 10 of these in total. This was, again, to put it in context, to remind you, this was done sort of in October, November, just when we were on the cusp of the second lockdown in England. All families who participated had at least one child under the age of 5 at home. In terms of recruitment for these interviews, we used what's called a convenience sampling strategy. That means that all the responses were known to our VCS, all respondents were known to our VCS partners. So they approached a family and said, are you willing to participate? And so they agreed. So they were already engaging with services, which is important to remember. Each interview lasted about half an hour, just sometimes a bit more. Participants were sent information about the study ahead of time so they could read about it, and the interviewers obtained verbal consent. The interviews were done on the phone, they were audio recorded and transcribed professionally, and each participant did get a £10 shopping voucher as compensation for their time. Next slide, please, David. The findings for these are very similar. You're starting to see a pattern here with everything that we've said to you thus far and that you've probably heard elsewhere too. The big theme that we picked up from these was about well-being, either physical well-being or mental well-being. In terms of mental well-being, people talked a lot about the various stressors that they were going through, either for themselves, their families. There were good outcomes reported as well. Of course, spending time with people, that was one. But there was a lot of focus and concentration on the tough bits, the stress. In terms of physical well-being, there was a lot of fear of becoming infected. Practical concerns, I called it that because it was sort of concerns around things like childcare. If an adult were to become ill or unwell, who would look after their kids in a time of lockdown? And decision-making behaviors was interesting. That came up a bit too, just in terms of the factors that people considered in terms of going out, meeting up with other people, whether they felt it was safe to be outside, whether it was safe to participate in outdoor sessions. So those are the kinds of things that we picked up. Cutting across well-being as a topic, we identified 3 sort of sub-themes that went across each. One was about support, and people gave a lot of examples of really helpful support. And don't go to the next slide, though. I'll tell you about that in a minute. So, you know, people coming around to check on them, helping with shopping. Those were examples of helpful support. There were some unmet needs as well, in terms of a few parents talked about some developmental concerns that they had with their very young children, and they didn't know how to access support for those. In terms of coping, there's a lot of discussion about being outside, going to parks, taking a walk, lots of physical activity, but again, primarily talking about being outside and going for walks. Digital engagement with services was mentioned. Some people were very enthusiastic about it and thought it was great to have webinars and podcasts that they could hear after the kids went to bed. Others didn't like it. They struggled with their children in terms of maintaining their interest in online sessions. Kids didn't want to sit. They didn't understand what was going on the screen. It was really different, was a message we heard a lot. Not all coping examples that people talked about were positive, just to say some people really did struggle and didn't have a positive thing to say. What struck me the most as we were going through and doing the analysis here was about, again, unsurprisingly, the importance of social engagement, how being connected and feeling connected and seeing other people helps, and that digital, whilst a welcome way to connect with health visitors and midwives and other activities, it's not a replacement for the real thing. Next slide, please, David. We have some great quotes from this, lots of rich quotes. Again, I won't read them all word for word. I'll just kind of skim through. For us, nothing positive has come of it. I can't wax lyrical about this wonderful time when we were all thrown together. It may have been like that if there wasn't this added stress, but because of it, it just didn't feel like a good time at all. Another quote was about becoming sick. If I get ill, I'm in charge of these kids, but with COVID, if you get ill, what the hell is going to happen to them? Another parent talked about coping. I tried hard to make his schedule varied, doing things and playing things, and not to use the TV, which would have been much easier. It just felt like it might have had a long-term effect on him, so we tried to get out to the park as much as possible. Another quote about digital and the difficulties of engaging a very young child. Quite a lot has gone online, story time and stuff, but my daughter, she was not having it. We would turn it on and she would just say like, no, I don't want to see. So we couldn't even have her play nicely next to us and take part. And finally, I think this is my favorite quote about helpful support. The kindergarten was brilliant over the pandemic because they did packs every day and came around. That was very good. And then there you had doorstep talks. I think that was the most helpful, I would say, because you had your outside social contacts. Even if it was just small talk, it did lift your spirit for the whole day. So I think that whilst the packs were important, potentially maybe even that face-to-face contact in a distanced way, that might have been even more important than the content of those packs. Next slide, please, David.
So thinking about phase 3 of the research thinking about, so at the moment we've got all of the findings are being written up into a research brief, which will be published shortly when everything has been pulled together and the findings have been triangulated. But really, as we're all learning, the length and impact of the pandemic is longer than any of us possibly anticipated, and so we're currently tendering for an evaluation partner, which is a piece of work that will support LEAP through the remaining years of the programme to look at the impact that we're having locally. But part of what we're going to ask the evaluation partner to do is to help us to evaluate and analyse the longer term impacts of Covid-19, both in what we the likely impacts that we can anticipate, but also potentially the unknown impacts at this stage that will last beyond the sort of medium term response phase. So the successful bidder will be designing, delivering and managing LEAP's independent evaluations, including the phase 3 of the Covid-19 research. Can I have the next slide, David? So thinking about the potential limitations of our primary research, in terms of responses, there were some incomplete responses to the family and practitioner surveys, as Carla mentioned as well. So some of the responses weren't included in the analysis. The sample of families was not representative of the LEAP or Lambeth population as a whole, and we had a limited engagement, unfortunately, from families who were hard to reach or families who were not already engaged with LEAP services, which was disappointing because we really used the resource of the emergency food parcels that were being distributed from the food hub by distributing the paper surveys as well as the digital offering of surveys, because we wanted to address that initial problem that we had heard from the Opportunistic Insights, which was that not all families were able to engage in online digitally. So we thought by offering the paper surveys that would be a good opportunity, and we ended up distributing almost 1,000, I think, paper surveys. And so it was, I mean, it was very valuable in terms of test and learn. We realized that engagement wasn't there from families, but it was disappointing to not see more responses from the paper survey, because we also thought that would be a good and quite a unique opportunity to engage with families who potentially were not already engaged with LEAP. So but that, you know, is something to reflect on and learn from as well. And then the bigger thing, which is overarching all of this, is that the COVID-19 pandemic and the restrictions that have been imposed as a result of it have evolved and have changed significantly since we first started developing this research team and the proposal and the rationale, which all happened in April and May of last year. And we've sort of evolved in a way as a research team, and even as we were developing questions and surveys and interviews, like everything has changed and we've had to respond really rapidly. And so you know, in terms of what we're learning, it really is just a snapshot in time, which is fine, but we're also realizing that you know, the learning is limited in that sense, because it really speaks to a very unique period of time, and everything is changing on a monthly basis for families and for practitioners, and so really the learning in a way is limited by that, unfortunately. Next slide, David, please.
So what did we learn? Well, we've presented today, like we've described, it was quite a big ongoing piece of work that we did. I think reassuringly, everything that we've learned, whether it was surveys, interviews, it was really consistent with other evidence that we've seen internationally and nationally about the impacts of COVID, just in terms of stress, impacts on family, on kids, on finances, on food insecurity. It's the messages, you know, we hear the same messages again and again. I think probably the top summary statement might be some people found lockdown periods stressful and struggled to cope, and others coped better. And for some people, there were positive outcomes as well. Practitioners, from their view on the ground, that people's experiences were varied, but families appreciated the chance to engage where they could. And we know that digital is not, you know, it is a great option, but it's not a substitute for face-to-face. So that's a key point I think we learned. We know that being around other people and being socially connected and engaging is critical for well-being. And like Claire just said, we are pulling together all these bits into one report that's underway right now and should be done soon. So if you want to dive into it a bit more and see some more of those great quotes, you can check the report. In terms of what LEAP's done, we just did a stock take of everything that we've done across the entirety of the program, the breadth of us. And we recorded this into a report which is available, and we can circulate after today. Just get in touch with us if you're interested. But we have done an enormous amount in response to COVID, as well as trying to maintain all the normal activities that we have as part of our portfolio anyway. So we continued with services and supported services to adapt to being online and digital. We provided quite a bit of financial support, especially in Q1 of last year, when a lot of our workforce was redeployed elsewhere. We did lots of comms and provided lots of info for families, including in a variety of languages. We have made a few changes to the LEAP portfolio. For example, we developed the postnatal meal service, which didn't exist before. We developed this last sort of May, June is when we started to deliver to fill a gap. We knew that people weren't coming around to see families with new babies in the same way that they might have. So we developed a service providing nice hot meals for new parents. And it bridged that very, very small gap in a small way. And finally, learning. Everything that we've told you about today, what we have learned, what we continue to learn, it's helping us to understand how better to meet the needs of our community. Next slide, please, David. And I think we included this slide just as kind of our next steps or reflections on everything thus far, everything we've done as LEAP, everything we've learned from various webinars and reports that we've read over the past year. And the current aim, as much as we can, is to move back and forth seamlessly between face-to-face and virtual engagement with families, obviously recognizing that face-to-face in person is the preferred option. The effects of the pandemic and the aftershocks, I think, are going to be felt for a long time, and it will likely influence our program for the remaining 5 years. We will continue to medium and longer term impacts, as Claire already described, and will adapt as necessary so that we can continue being a force for good and improving very young kids' outcomes locally in Lambeth. And I think that takes us to the end of the content. Is that right, David? I think we have a chance now for questions.
Right. There were a few
questions.
Sorry, there were a few questions. Let me just get them up. So everything that we've learned thus far, what's the most essential learning for LEAP as a programme, do you think?
Good question. I mean, I think in terms of, I think one of the overarching things was this idea of connection, and like Carla said from the interviews as well, like in terms of well-being and connection, and sort of like having an opportunity to connect where possible was something that really kept coming through, that parents really appreciated, like having social connection, whether it was virtual or on the phone, just having an opportunity for support and for continued support with services was something that when it was possible, parents really appreciated. And I think that was possibly one of the main things that came through as important. And then I think as well, like this idea that it's hard in terms of like overall, I suppose, like thinking about, there were so many teething problems with digital engagement and virtual offers, but from this point in time, it seems like people really valued the opportunity for digital services. And so I think going forward, like Carla said, like having this ability to move between face-to-face and virtual, actually there was quite a lot of positive feedback from families having the opportunity to engage in a virtual way, and practitioners as well reported that they felt that families actually, whether it's that, you know, there was a brand new baby at home, or whether it was working patterns, like the ability to engage virtually was actually a benefit for some families, because it meant that there was like this flexibility that perhaps wasn't there when parents were having to come to a children's centre, for example. And there was a few reports of fathers, of men being able to engage in a way that they perhaps weren't able to when things were, you know, face to face, and perhaps working patterns didn't allow for that. Yeah, I think that they would be the overall learnings. And then it's like Carla said, thinking about the next steps and how we operationalize that going forward, and thinking about the landscape that will have been transformed in a way. And that's sort of the thinking that we need to do in terms of phase 3 of the research, is what does that mean for us as a program? And it's hard to say at this stage from this perspective exactly what it means, but yeah, but that's the learning that we need to apply really as our next step.
I've got another question. What can we do to ensure that those seldom heard or hard to reach families' experiences are heard and used to inform services despite not being captured by the research?
It's a great question. And I think that's a perpetual public health conundrum in making sure that we capture not only the views of families who are happy to participate in, I mean, I'm reflecting back in pre-COVID when we would run focus groups, you know, there were people that were happy to contribute and share their views and help shape our services. And I think that's always the dilemma, is are we making sure that we're hearing? And I would guess that most programs are not. And I think that there's a variety of things that we need to understand in terms of engaging underserved populations, not the least of which is language. I don't think we can exclude that as an important factor. And I do think we're addressing that. I mean, we have a robust network of parent champions who are connected to these communities. So I don't think there's one answer here. I think there's a variety of answers. And I would suggest that it's not enough to just say, we're here, come to us. I think we need to make sure it's really, really easy to access. And it needs to feel relevant. I think that's not an easy one to answer, but it's definitely an important goal.
There's something about trust as well, I imagine. People aren't going to come to a service if they don't trust you. Okay, I've got another one.
Yeah.
What might you do differently if you were to do it all again? Reflecting on your experience.
What, the research or our lives?
It's the research. Let's keep it brief.
I mean, it's so hard. I think, I mean, so much of this was, it had to be test and learn, because, you know, we even writing the secondary research, like there were things being published every single day, and, you know, we would have a final draft and then it would have to be redrafted and rewritten to include an emerging report from the Children's Commissioner, or, you know, whatever it might be. That was the challenge, is that I certainly have never conducted research in this way before, where like there's a you know, the sort of context that you're working in locally, nationally, worldwide is changing every single day. And I mean, it's so hard, because looking back now and trying to address that is a very different thing. Like, I think probably, you know, knowing what we know now and redesigning the research would be a real luxury, but actually it just was so hard to predict. Like, you know, I guess potentially it would be really nice to have spoken to families and practitioners in the much sooner, I suppose. Like, that would have been good, to speak to practitioners sooner than September, but for a whole host of reasons that just wasn't possible. And so we ended up asking practitioners to think back over quite a few months. And, you know, in September we'd already been through like a national lockdown, easing of restrictions, and then the potential of a looming another national lockdown was on the horizon. So it was a big ask, actually, for practitioners to think about that period of time, because their working lives had shifted so dramatically and shifted back again. So that wasn't ideal, I think. But then again, yeah, we were doing everything as rapidly as possible, but it wasn't rapid enough, really, probably is the biggest thing. And we were trying to follow like best practice research wise, while trying to capture different voices. Yeah, I mean, probably everything, honestly, but it just was really hard. And, you know, our research team was comprised, like Carla's team, like the strand leads, and they were also dealing with on the ground challenges of, you know, working with services as well. And everyone was just stretched in a way that was really hard to manage. And yeah, the question of whether it was best practice or not is, yeah, a big one. But really, like, we did the best that we could. And I think, yeah, there was just so much to try and anticipate and also execute at the same time that, yeah, it was, I don't know, Carla, if you have anything to add. I'm just like having an existential crisis, but
no, I don't know what we could have done differently, to be honest with you, because this has been such an up and down year. I can't imagine what we would have done with all the ins and outs of lockdown and everything else. I don't think I would change anything, to be honest with you. We responded quite.
Okay.
Yeah, we did. We definitely did the best we could anyway.
Okay, I think that's it then with the questions. So thank you both for interesting presentation of your findings. Okay, so thanks everyone for attending, and hopefully see you soon.